Ask your question.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister for Health the plans the ministry has in recruiting nurses who have completed the mandatory service and the batches or year groups that are next to be recruited. Thank you.
Yes, Honorable Minister.
Mr. Speaker, progressively, recruiting health professionals into the public health sector remains a priority for the ministry. As such, the ministry has developed a comprehensive medium-term recruitment plan for the health sector, covering 2026 to 2028. This year, we are recruiting 16,000 health professionals for distribution across the country, especially to the underserved areas. In the nurses and midwives category, we are prioritizing the recruitment of the 2021 batch, with the first phase almost completed. Interviews at the various district levels have been completed, and professionals are currently reporting at their various permanent workstations. The second phase of the recruitment process will be undertaken before the end of this year. The 2022 batch of nurses will be the next to be considered, and the 2023 batch of nurses will continue in that order. The Ministry of Health remains committed to the progressive recruitment of qualified health professionals to strengthen healthcare delivery across the country, subject to the availability of financial clearance, from the Ministry of Finance and guided by the staffing norms of the ministry. Thank you.
Honourable Member, any supplementary question?
Thank you, Mr. Speaker, and thank you, Minister. In your answer, you mentioned that you are recruiting 16,000 health professionals this year, that's in 2026. May I know the number of nurses and midwives that are included in this 16,000? Thank you.
You are talking about the classification?
Yes, Mr. Speaker, just the nurses and midwives.
To classify it?
The number included the 16,000. He just mentioned that they are recruiting 16,000 health professionals. And my question is...
Very well, very well.
Thank you.
Yes, sir.
Mr. Speaker, for the sake of clarity, I said we are doing 16,000. We have been given clearance for 8,000. And we are almost concluding on the 8,000. Now, if you ask me the number of nurses and midwives in the 8,000, because we have concluded, I'm able to tell you. But I cannot tell you the number in the 16,000 because we have not concluded on the 16,000. In any case, the number in the 8,000 is 6,500. Thank you.
Honorable Kwajo Nkrumah, I'm surprised. You of all people. Any further question?
Yes, Mr. Speaker. Can the Minister tell us the number of qualified nurses and midwives that are yet to be recruited outside the 6,500?
Honourable Member, your question is clear. You are asking the Minister of Health the plans the ministry has in recruiting nurses who have completed mandatory service and the batches or year group that are next to be recruited. So he is prepared to come and answer that particular question. And you are saying, what is the number that has not been recruited?
The Speaker, thank you for your guidance.
I think he wrote mathematics question long ago.
The Speaker, I understand where you're coming from, but my understanding is that you cannot prepare for a group of people without knowing the number. So if you are preparing for them in terms of budget and the rest of it, how do you prepare if you don't know the number?
But your question doesn't demand that.
I ask the plans you have.
If I ask you to come and tell me the number of people that you have recruited, and you've come to tell me this is the number, and I'm telling you what is the number that are not recruited, this is a matter that you need to refer to the record to come and answer. Do you agree with me that you must refer to the records to come and answer?
The Speaker, you can come from that angle, but I was thinking that because he's a minister, we must have the data of all the qualified nurses that are recruited in the
I
country.
indicated here that ministers come here with a prepared answer. So you give him the notice of the question, you prepare the answer to come and give you, but not to take him by surprise.
So I should take it to mean that the minister doesn't know the number.
If you have another question, ask.
Thank you very much. There's no question. Thank you.